Hi, I'm Nitya Munikrishan. Today I'm here to present the group assignment for the subject um, intervention for children with special needs. The assignment title is Disabilities Factsheets. So from disabilities I choose Down syndrome. So what is Down syndrome? Down syndrome is a person born with an extra copy of chromosome 21. They have 47 chromosomes totally instead of 46. This can affect their brain and physical develop or body develop the changes in their body. People with Down syndrome disabilities lives happily with a supportive care. They must have a person to care them, so it's to take care of them because they will be a person who's cheerful. They will be cheerful, and then they will get excited. They will also over care for people. What causes and types of Down syndrome is there is three types of causes. The first one is trisomy 21. So every cell in their body has three copies chromosome instead of two, so they will have the extra chromosome. The reason of their disability Down syndrome. Okay, the second one is translocated Down syndrome. The translocated Down syndrome is the chromosome attached to another chromosome, which make the another part look extra. It will attach to the like the top. The top they will attach, and then the reason they are disability of Down syndrome. So uh, for the third one is mosaic Down syndrome. Mosaic Down syndrome is they have two types of mixture cells. They are mixed with the cells. So some contain the usual 46 chromosomes and others contain 47 chromosomes. What is the characteristic of Down syndrome? Down syndrome, as we can see their body develop by their eyes, small ears, the normal ears, they will have the different like small, and then maybe for the high at the side like that, and then flat nose bridge, and then short neck. Maybe their back neck will big a bit or up a bit, so we can see their face and then the body, and then they will always keep their smiley faces with them. So we cannot see them with like normal people. If we are angry and we walk, we cross them, and we will sure we will smile with them because they always keep the smiley face with them. Down syndrome don't have any symptom because during the division process at early stage of the pregnancy mom it happened. So there is no symptom that we can see. It was developing after they born. It's before they born already. Inside the mother's the child is already create the growth was happened from the chromosome divisions, the cells divisions. Okay, what is the potential impact on individual life? Okay, health challenges. They will face the health challenges even they looks happy, smile, and then with a supportive care they still can face the heart defect, hearing, or vision problem. Maybe they have the vision problem, or physically they are slow in the development, so they need time, they need space, they need people who can understand them, can treat them in a better way and the responsible way. We should sincere when we are teach them, when we are together with them to play, or just we cross by them. We need to remember that they are not normal, but they still have different kind of skills in themselves. So the second one is learning difficulties. Same as I told for the health challenges, they will have the memory difficulties and then slow their language development, so they need time to process and the progress. So we need to be the calm person to handle these down syndrome disabilities children. For okay, the third one is social. The social is few of them need support for lifelong, and some of them are semi-independent, work and develop strong relationship. Okay, example, some of them are really the parents are worried, or the educators are worried, maybe their development is not that much ready to they handle themselves personally or independently. So what happened here is they need a supportive care for lifelong, even for the small thing like going out to purchase, or going out to the party, or anywhere they go, they must have somebody to care, the supportive care. The semi independent is they can work, they are good in few skills, few field, so they can go for that to develop their future life. What is the potential impact of the disability on learning and social interaction in education setting? So for the learning and social interaction in educational setting is, we have four category that I uh, noticed from the article and then the other webs. So first one is attention difficulties, like I say for the challenges. So they have the attention difficulties because they need do the same thing for repeatedly. They will do the repeated activities. If you give the small activities like please close the door, and then they will recheck and then redo the process to close the door. Maybe they will open and then close, open and then close, it's that close like that. When we see as a normal person, we thought okay they are playful, okay they are but when we it's come to learning or education setting, we need to know that they are progress, they are processing themselves to do the activity, even it's about the closing door, opening door, writing, or using the duster to clean the whiteboard. So everything they need a time. And then sometimes the attention difficulties is uh, we we are um, having some hard times as educator or parents to grab their attention while study, or to give them the time to learn. So they sometimes they will uh, be the good one, so they will sit properly and then they will listen to us. But sometimes they will do the naughty things, like they are not going to ready to the not ready to listen the lessons, they are not ready to focus on the lessons. So it may difficult to the other children if they are combined with the normal student, or they are study separately with the disabilities children. because disability has many types. So Down syndrome is children with playful, and then they still got the pain from the body development. The second one is lower pace learning. So same as the attention difficulties, they need time to process and progress. So they need to take time to learn one by one, step by step. So we cannot treat the child as normal child. We give the homework for the long paragraph writing or reading. So they need a time to progress. They need to focus on that, so it take time. So when we are educate or working on this field with the Down syndrome children, we really need relax and sincerity to the children, to educate them and then to let them understand about the lessons to help their future. The third one is difficulties with communication and peer relationship. So this is, we can see from the way they getting friendly with the normal student or other disabilities children. So when it's come to educational setting, we can see they have separate classroom, or maybe they will uh, go for the combined classroom. So what will happen is these children are over care, and they will over love the person around of them. So they are, we cannot stop them. So maybe they are hard to understand, but maybe we can approach the opposite person or others to be friendly with the Down syndrome disabilities children. The last one of the learning and social interaction in educational setting is risk of bullying by classmates. This may happen at all the way and everywhere. So maybe these are the reason the children get trauma and tantrums. So risk of bullying is will happen during the classroom that combined with the normal student, because they the normal student age and this Down syndrome children age is same, maybe same, but the development is different, which can the normal student think for bullying the person who is not act as a normal child, because they are not normal children. So they need a supportive care, and then they need something can be friendly with them, someone who can be friendly with them. So when we combine with the normal children, it's really a big responsibility to take care of them and the environment to be safe and secure. The rest of the slides I will pass to Subhashini to present. Thank you. So this is my individual reflection based on the previous slides and the disability Down syndrome. So personally, I have learned a lot during the research of the article and known more about the Down syndrome. So I can understand the Down syndrome children should take care very well. They are innocent. So as known, they are innocent, they are playful, with many talented skills, and that they are developing themselves to get or create a better future for them. So these children should take care by the caretaker, educator and their parents. They are also facing the tantrums by bullying, and then they also concern them by their facial features, because they are by the body physically they are looks different from the normal children, so the chances is high to be get bullied by the normal children when they are combined classes and then meet the new people. So I get know how to treat them while doing the research, because when I read each article I can understand how I can be a person to treat or educated to be, because they are innocent and then they need the support and then the care to be around of them. So they are maybe stubborn certain time to act or repeatedly actions, so we just need to be sincere to educate them. Now I will pass the slides to Subhashni to convey a reflection based on the slides.
Hello, hi, I'm Subhashini. So I'm going to continue with slide 8. Bullying from classmates. On the positive side, most children with Down syndrome are very cheerful, friendly, and socially active. This makes them wonderful classmates and friends. Next, behavioral challenges. Some behavioral challenges include stubbornness, difficulty in paying attention, and sometimes compulsive or repetitive behavior. Teachers and parents need to be patient and consistent when handling this situation. So now look at the strategies and accommodation. To support students with Down syndrome, teachers can make the classroom environment comfortable and reduce distraction. They can also provide social and emotional support such as encouraging group activities and teamwork, using visual aids like flashcard videos and gesture breaking tasks into smaller tabs, and giving extra time are also very effective strategies. With those supports, students can learn better and feel more confident. Parents and teacher consent. Parents often worry about their child's future, whether their child will grow up to be healthy and independent. Teachers, on the other hand, may worry about how to grade these children or whether to give them extra time. The advice is to focus on positive reinforcement, be consistent at home and in school, adjust teaching methods to suit their learning pace. This helps children grow in a supportive environment. Now, continuing with the fact sheet, we can see a summary of Down syndrome, what it is, its cause, its effect, and how support can be given. This fact sheet provides quick but important information. Cause and types. As explained earlier, Down syndrome can be caused by trisomy 21, which make up about 95% of cases. Translation accounts for about percent, and mosaic Down syndrome makes up about 1%. Trisomy 21 is by far the most common. How common it is? Down syndrome occurs in about 1 in every 700 babies. In the US, around 6,000 babies are born with this condition each year. Although the risk increases with material age, especially for mothers over 35, Down syndrome can occur at any age. Health issue and life expectancy. Some common health concerns include heart defect, hearing and vision problem, sleep apnea, and a higher risk of infection. The good news is, with medical care, most individuals with Down syndrome can now live into their 50, 60, and 70 longer. Learning and behavior. Children with Down syndrome may face learning challenges such as speech delays, attention problem, and intellectual disabilities. However, they also have many strengths. They are often friendly, empathetic, and cheerful. With support, they can achieve independent success in school, even in work and arts. Support in the classroom. In the classroom, teacher can use visual aid, breaks tasks into smaller steps, give extra time, and encourage peer buddy system. Celebrating small achievement is also very important because it builds motivation and confidence. Parents and teacher concern. Parents often worry about their child independence and life skill. Teachers sometimes wonder how to grade fairly, whether to give extra time. The best advice to focus building life skill, giving flexibility, and using positive reinforcement both at home and at school. With those support, children with Down syndrome can grow up, live fulfilling life. Thank you.